Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about hygiene, I hope you have got a clear understanding of why hygiene is important, as well as what are the various factors that can influence the hygienic care of an individual, right? We've also started discussing about the care of skin that a nurse can provide for those clients who are not able to perform or maintain their own personal hygiene. And in this session, we are going to discuss about the care of eye. Eye care is defined as a procedure which is done for assessing, cleaning, irrigating the eye, as well as for the installation of any prescribed ocular preparation. And what is the purpose of this eye care? We perform this eye care in order to relieve pain or any discomfort, in order to prevent or treat any infection that may occur or which is already occurring, to prevent or treat any injury of the eye, as well as to detect the presence of any eye disorder at the earliest stages. This eye care is also done in order to detect the drug-induced toxicity at an early stage, and also to prevent the occurrence of any damage to the cornea, especially in the sedated as well as in the unconscious client. So these are the various purposes of eye care. So what are the equipments which are required for you to perform this procedure? Here, before you provide any eye care to the client, you need to make sure that there must be a sterile tray containing the cotton balls, the thumb forceps, bowl, kidney tray, towel, as well as sterile 0.9% of sodium chloride. So here, before you perform this eye care, you need to make sure that you arrange all these equipments, all of these articles. And after these articles are arranged, then you must prepare the client as well as the unit. Here, when you are preparing them, the first thing you need to do is that you must explain the procedure as well as the purpose of why you are providing this care to the client. You can also explain how the client can help you while this procedure is being performed for them. You must adjust the bed to the comfortable working position of the nurse. So here, the height of the bed should be adjusted to such a position that it will ensure the comfort working of the nurse. And as I've said, you have to arrange all these articles, right? So you must also arrange these articles conveniently on the bedside of the client. You can also keep the client flat if the condition permits, and you must also make sure that you remove all the extra pillows and just keep one pillow under the head of the client. And since a pillow will be kept under the head of the client, in order to prevent this from getting wet or soiled, what we must do is that we must cover it with the Macintosh as well as with the towel. So here, after you have prepared all the articles, as well as after you have prepared the client as well as the unit, the next thing you can do is you can start off with the procedure. So here, you must place the patient head well, supported with tilted back. And after this, you must make sure that you wash your hands thoroughly using a bactericidal soap, because as we've been repeatedly discussing, that hand washing is very important each and every time before and after you perform any procedure, right? So here, even before you perform this eye care, you need to make sure that you wash your hands thoroughly for all time, which means whenever you are performing this eye care, you need to make sure that you start off with the uninflamed or the uninfected eye first, and then move to the inflamed or the infected eye. For example, if a client has an infected right eye, what you will be doing here is that when you are providing this eye care, you will start with the left eye first, because this left eye is infected, right? So you start providing eye care on the left side of the eye first, and then you move on to the right side of the eye. So here, you will be taking 2 cotton balls, you will be dipping this in 0.9% of normal saline and then squeeze it. And after you have squeezed, then you can start cleaning the eye. And I've said that whenever you clean the eye, you need to move from the inner canthus to the outer canthus, right? So here, again, after you have squeezed the cotton, what you will be doing is that you will start cleaning the eye from the inner canthus to the outer canthus. And when this is done, you must make sure that you do it in a straight single stroke. And when there is presence of discharge, then you need to repeat this step again and again till the discharge is removed. However, when you are repeating this step, you need to make sure that a new swab is used each and every single time, because as I've said, whenever you clean it from the inner canthus to the outer canthus, you need to do it in a straight single stroke, right? However, if there is presence of discharge, then in order to remove that discharge, you need to do it again and again. So when you do this, you need to make sure that each and every stroke you do, you need to use a new cotton swab for it. So once these eyelets have been cleaned, you must dry them out, and once they have been cleaned as well as dried, then you must make sure that you return that particular client in their comfortable position. And once this is done, you can discard the waste according to the hospital policy. You must replace back all the articles and also send the articles for disinfection or sterilization as required. And then you must again wash your hands, after which you must record the procedure in the nurse's record. And once this is done, then what you must do is that you must instill any medication that is ordered by the physician. Then you must remove the mackintosh and the towel which was placed under the client's head. You must adjust the position of the client in bed. You must tidy up the bed as well as make the client comfortable. And then you must take all the articles to the utility room so that you can clean them. So here the bowls can be sterilized, the towels can be sent for laundry, and then the other articles can be placed back to their proper places. And once all of these are done, then you can wash your hands thoroughly, and then you can record the procedure along with the date and time. And here, if there was any observation which was made by you while you are providing this care to the client, then you can also record them in the nurse's record. And here you can also record the observations which was made by you while you were providing that procedure to the client on the nurse's record. So these are the various steps that a nurse must follow whenever she is providing this eye care to any client. So now here we have come to the end of this small topic, whereby in today's session we have discussed about the eye care, where we have come to know that eye care is a procedure which is performed in order to clean, to assess, to irrigate, as well as for the installation of the prescribed ocular preparation. We've also learned about the various purpose of eye care, the equipments which is required, the preparation of the unit as well as of the client, and at the end we've also learned about the various steps that we must follow whenever we are performing this procedure for the client. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session whereby we will be discussing about the care of ear and nose. Until then, have a good day. Thank you.